One is going to be dedicated to product innovation in times of crisis. My name is Madison. I am the content creator and community manager for MistyWest. I'm also the organizer of the hardware meetups. We organize about quarterly or bi-monthly to offer networking events for hardware developers, product developers, engineers, and makers in the Vancouver community to come together and connect. As we all know, there's been some massive changes around the world, so we've adapted to trying out the virtual format, and we'll see how today goes. You can see on the left here all the different meetups that we've done in the last few years. So we've done ones dedicated to machine learning and artificial intelligence. In November, we organized a meetup dedicated to evolving 3D printing technologies. And back in September, we organized an event for technology for conservation. And if you are interested or have any other questions about Vancouver hardware meetups, you can send an email to me at madison@mistywest.com. So we do have just one code of conduct here for today's discussion. We are committed to providing a harassment-free experience for everyone at our events, and that includes our virtual events. So please take a moment here to just take a quick browse of the code of conduct and know that any comments in our live chat of a harassing nature are not going to be tolerated. And if you are in violation, we will have to remove you from the discussion. So today we have a panel of experts joining us to discuss product innovation in times of crisis. Leigh, Christie, our co-founder here at MistyWest, has been very motivated and very organized ever since the pandemic and the quarantines. He's been motivated and assembling other engineers in the community to come together to try to come up with solutions for fighting the pandemic. And so that is why we are bringing together this panel discussion for you today, so we can get some feedback from those in the medical community and hardware development community about what we can do to help prevent the spread of illness. And I'd like to just thank our partners that are joining today and that helped organize this. So MistyWest, Envisioning Labs, and the open source COVID-19 medical supplies group for BC. And joining today's discussion, we have 5 panelists here, each ranging in different areas of either medical science, medical tech, or just hardware development. So we're going to get some insight from everybody in the panel, and they can introduce themselves when they start the discussion. I don't want to take a stab at pronouncing everybody's names in case I get anybody's names wrong right now. And Leigh is going to be moderating the discussions today. Leigh is one of the co-founders of MistyWest, and as I mentioned, also the founder of the open source COVID-19 medical supplies group for BC. Today's session is going to have the first 30-minute panel discussion on designing life-saving medical devices. So it'll be about 30 minutes in length, moderated by Leigh. The second panel discussion is going to be on policy and product innovation, moderated by Leigh, and we'll also have Victoria and Elise on the panel. And for whatever time remains at the end, we will also include some announcements, some from MistyWest, but also from our panelists if they have anything else that they'd like to share, and just a quick little list of upcoming events. And we have some quick questions to kind of give you an idea of what's going to be asked for the panelists at the start of the discussions today. So if any of our viewers have anything they want to contribute to the live chat, feel free to leave a comment, but just know the comments won't be addressed until after the discussion. And there's also about a 15-second delay. So if you notice that we're not answering right away, it's because it's just our video feed is just a little bit slower. And that is pretty much it. So I'm going to stop sharing my screen, and then I'm going to hand it over to Leigh, and Leigh's going to begin our discussion. Thanks, guys.
Thank you, Madison. That was fantastic. First of all, I should introduce myself and say, I'm Leigh Christie. I'm one of the co-founders of MistyWest Engineering in Vancouver, BC. I'm also a co-founder of the OSMSBC, which is the regional chapter of an international organization of over 100,000 volunteers that are focused on designing and engineering and manufacturing equipment and medical devices and PPE to help fight COVID-19. Here today on the panel, you'll get to meet a couple of people that are part of the OSMSBC, and as well as many of our, I guess you could call them design team and industry partners that are intimately involved in fighting COVID-19, as well as some entrepreneurs that are working on products during COVID-19, or innovating on projects during COVID-19, which is, I think, really the main topic here today. A lot of people ask me frequently over the last month and a half. I've been doing these Ask Me Anythings on, I don't know if you guys have seen these, they're pretty hilarious, but I've been doing these Ask Me Anythings on Facebook. So launching them from my personal page, or launching them from like the OSMSBC page, or launching them from the MistyWest page. And we get the most random people joining these from like all over, because I've lived in New York, and I've lived in San Francisco, and I've lived in Boston, so I've lived in Paris. So a lot of people are joining the sort of internationally, and it's crazy. Some of the questions are crazy, like saying things like, I've heard that masks can cause COVID-19. Like if you wear them, it'll make you get COVID. And you know, some of the myths out there, it's just incredible how much confusion and frustration and pessimism there is out there. And I think it's really exciting sometimes when we get to see people that are brimming with enthusiasm and brimming with this sort of resolve to fight COVID-19. I think that can really kind of bring a lot of hope to a lot of people, especially when people are so afraid of a second wave. I think this conversation is kind of happening in the context of a potential second wave. You know, people relax their guard a little bit, and all of a sudden, you know, we relax the rules a bit, and all of a sudden, people suddenly forget how important hygiene is, or how important it is to reduce the radius of infection, or things like that. So that's the sort of the backdrop for the conversation. And in doing these Ask Me Anythings, one thing that came up very frequently was, why don't we do a webinar? Why don't we do a panel? Like, let's get all these really interesting people together. And so I'm here today to introduce you to 5 of the most interesting people I know that are fighting COVID-19, or in some cases, launching business innovation practices during COVID-19, which I think is equally as important, if not more important. And so why don't we just take a second here to get everyone to introduce themselves. So Laura, David, Elise, Oscar, and Victoria. Let's go through the list, starting with you, Victoria. Go ahead.
Okay, so I'm Victoria. I am a engineering physics student at UBC Vancouver, and I'm also a manufacturing lead with OSMSBC, very proudly. And yeah, that's basically all there is to me. I've done some research with medical devices in the past. I worked at the aerosol lab at U of A, and yeah.
Awesome. Thank you so much. Elise, go ahead.
Hi, everyone, and thank you for having me here on this panel. I'm very excited today. My name is Elise, and I work for Arbutus Medical. I'm one of the co-founders of this local Vancouver company. And what we do is we make affordable orthopedic power tools. We originally started making them for developing countries, but they are now also used in multiple markets. And the concept that we work of is actually frugal innovation for healthcare.
Thank you. Oscar, go ahead.
That's really cool. Frugal innovation. I love that concept, Elise. My name is Oscar Malpica. I'm the CEO of a small innovation firm here in Vancouver. We are an emerging technology and innovation consulting firm called Envisioning Labs. We work mainly with medium and large size organization, fostering innovation in 3 main areas: education, innovation education, that is, R&D, and one thing that we call envisioning services, or the designing of future scenarios to understand how technology vectors will morph products, services, and a way of consuming new experiences.
Thank you, Oscar. Laura, go ahead.
Hi, thanks as well for having me. I'm excited to be a part of this. I am a PhD student at UBC in biomedical engineering, and my research is not really involved in what I'm doing at the moment. I kind of work with cell therapies in my lab, but for the last 1 to 2 months, since work from home started, I have started this, I guess it's a startup at this point, but we have created a low resource, low cost ventilator for use in the COVID-19 crisis. And I'm one of the design engineers on my team called Flow 02. And I will leave it at that, and hopefully we'll talk about that a little bit more later.
Cool. And Dr. David Kim, go ahead.
Hello, everyone, and thanks for having me on the panel, Leigh. My name is David. I'm a resident physician in emergency medicine at the Vancouver General Hospital. I'm also the CEO of Difinity Solutions, and we're a medical device company working on new medication delivery systems.
Amazing. Awesome. Okay, so the way this is going to work, originally we had planned on doing 2 separate panels just for practical reasons. We're all in the same Zoom here. So I think I'm going to be a little bit lax on the rules. The first panel is Victoria, Oscar, and David. The second panel is Elise and Laura. But we're gonna relax the rules a little bit. So we're gonna make it so that if you have something really important to say regarding a specific question, you're allowed to break into the other panel, okay? And vice versa. But the bulk of the questions for the first round will be directed to Oscar, David, and Victoria, and the bulk of the questions in the second round will be to Elise and Laura. All right, so here we are. Let's, oh, actually, we almost forgot. We always start out with 3 deep breaths, including the audience. There's 81 people participating in this today. So everyone has to take part. This is not optional. It's a tradition, an honored tradition at both MistyWest as well as the OSCMSBC. So here we go. 3 large breaths. It's real easy, nothing to it. And starting with the first. That's all there is to it. All right. How y'all feeling in the audience? We'd like to see your comments and questions. Please do post them. If you're trying to figure out how, look to that little box to the right of your screen in YouTube. It'll say like your name, and then it says underneath that, say something. Try typing in there. Don't be shy. We want to get that conversation going as active as possible. Feel free to post your questions early. Madison and others and people from the OSCMSBC side, including Azure, will be able to kind of keep track of your questions, and then we'll make sure they get prioritized at the end of each panel. All right, so here we are. Let's get started. So the first question, I think we're just going to hit it right off the bat and jump right into it. I'd like to ask, how has COVID-19 impacted your life and your business and your projects? You can answer all 3 or just one of the 3, but how has it impacted you and your projects and your, I guess you could argue the sort of the almost like has it impeded your progress? Has it motivated you? How has it impacted you? We'll start with David. Go ahead.
Great question, Leigh. I think first and foremost, because my life is around a clinical setting at work, it's really changed how we practice medicine and how we treat our patients, especially because I work in the emergency room. The concept of treating patients without a mask, without gloves is so foreign now that everyone is in protective gear. We're all taking precautions and doing our best to treat, triage, and handle cases of COVID and non-COVID cases as they come through the emergency room at the Vancouver General Hospital. So from a clinical sense, we've done a lot of new innovative thinking around how we're practicing medicine, as well as new and innovative treatment strategies around flow and patient care, as well as patient triaging, which has been really interesting to be part of in the emergency room and also and beyond. In terms of my company at Difinity Solutions, it's also been an interesting time there. I think COVID has given us a bit of a time to kind of reflect on our product portfolio and given us a chance to actually diversify some of our product portfolios as well. Thinking about not just the previous ways of doing things, but in the context of COVID, how can we ensure that the products and the things that we're working on can be beneficial for the patient population in general, as well as in context in line with COVID, in terms of how can we help COVID and make sure that patients are healthy, long and short term.
Thank you. That's a great answer, David. Yeah, so we're going to get into a bit of more of a discussion soon here, but we're just going to go through each person one by one here with the same question. Oscar, go ahead.
Yeah, so for us, it's a little bit weird because, you know, we have good, bad, and ugly in here. So let me start with ugly. Ugly essentially means not able to complete some of the projects. Obviously, you know, we require on-site presence in our labs, in our workshops, building things. That's what we do. You know, we do a lot of R&D. And some of that requires us to be on-site, assembling stuff, trying new things, experimenting with whatever you may have there. And so that's been obviously a huge impact, negative impact on our business. On the positive side, because we are an innovation consulting firm, we're able to very quickly jump into whatever the innovation opportunities lie. And right now, those opportunities lie on mitigating the effects of COVID-19, whether we're developing a new product like with you guys and David, whether we're developing new protocols for social distancing, whether we're designing new environments on how to safely perform different activities. So we've been busier than ever, I can tell you that. And that's really in the nature of our own company's DNA. We always go where innovation opportunities lie, and every crisis is always ripe with opportunities fresh for you to just go and take advantage of. So we subscribe to the ideology of whenever you have a crisis, you can either be on the camp of just worrying, being hysterical about, you know, whatever worry you, or you can take action, or you can take a more proactive approach, assemble with people that are together, and then go with that. And I think we lose you, Leigh. I don't think we can hear you. Nope.
Great. No, sorry. I was classic COVID-19 moment. I asked my lovely wife to pour water quietly. Lucky for me, I have the most caring and loving wife of all time. So she's extremely patient and tolerant with me when I have 82 people on the line. Awesome. So thanks, Oscar. That's a great answer. And Victoria, go ahead with your answer.
Yeah, so I'm going to split this up a little bit concretely, but when I first think of like work, I'm a student, so all of my schoolwork has been moved online, even as just an undergraduate. I'm also a varsity athlete. I'm on a team with Laura, actually. And so all of our final year sporting events were canceled. So that's just the baseline things. But when it comes to my personal life, my parents are both physicians. So for them, things have shifted a lot as well, probably quite similarly to you, David. So for example, I was going to go home over the summer. I'm now staying in Vancouver because it's safer for me to be here than to be interacting with my parents at work back home. On a project side, I was lucky enough to be able to join in with Leigh at OS, which at the time was OSCMSBC. Name has changed to get rid of the COVID to make it more general, but I was lucky enough to join in at the beginning and watch that team grow. And what we've been able to do by connecting design teams to our team of volunteers has been really incredible. And I've just really enjoyed watching that process and being involved. So yes, there are some negatives, but I think I can agree with all of you when I say that there are some positives and there's always a silver lining. So yeah.
You know, it's funny the way you just said that made me think like almost like a marketing or branding statement, like, hashtag drop the C. So we as you guys may know, we are the the open source COVID-19 medical supplies of British Columbia. And of course, we have aspirations to be a open source medical supplies nonprofit for British Columbia many years into the future, long after COVID-19 is no longer a problem. And so we did drop the seed for that reason, as did the mothership, our parent organization, the OSMS. But yeah, it's interesting. I hadn't thought about it that way, but it really not only did we do that to prepare for the future, but there's something to be said about really focusing on trying to innovate in such a way that not only do we get rid of COVID, not only do we fight it to the death, but we also drop the seed, right? We start to see our loved ones again. We start to get to hang out with our parents again, right? I can't wait to hang out give my mom a hug. How many of you guys? Well, actually, that's the next question. Actually, David, when's the last time, or Oscar or Victoria, when's the last time you gave your parents a hug?
October last year.
Last year?
November last year.
November last year.
Christmas.
Yeah,
Christmas.
Christmas.
Yeah, it's tough. All right, so let's jump into it a little bit here with respect to the challenges. So let's start with some of the challenges. Oscar, you brought up some of the challenges that you've run into. Obviously there are opportunities with COVID-19, right? It's like, you can think of it almost as a little bit, a lot of people don't like this terminology, but you can think of it as a little bit like a war effort, right? Nothing unites the human species faster than an existential threat, or something that could cause the loss of millions and millions of lives globally, right? We're all affected. There's no country, there's no region of the world that is like, oh, this isn't our problem, this is everyone else's problem, right? And there are problems out there that cause what people call the tragedy of the commons, right? You could say that that's true to some extent for global warming, right? There's certain countries that maybe aren't as affected as others, or maybe they don't see the effects as much, and there's certain people, certain individuals who haven't really seen the effects viscerally within their families, and thus they are inclined to say, well, this isn't my problem, right? And you do see that a little bit, I think, with COVID-19, but I would say from what I've observed so far, we're really seeing a lot of people becoming very motivated, very focused. And so there are these kinds of silver linings. So I guess what I would like to ask is if you could sort of name a big challenge that you think deserves more attention with COVID-19, and if you could maybe bring up a silver lining, so sort of a challenge and a silver lining. A duo question. Starting with you, Oscar, go ahead.
I guess last year at Envisioning Labs, we made it so that our DNA has to be pegged with the United Nations Sustainability Development Goals. It has to be, and simply because we really believe that is the main challenge that we as humanity face. It's a chronic problem. It's not an acute problem like COVID-19. So it will extend for decades, probably this century and centuries to come. But we actually really believe that is the main problem is climate change, period. And so the United Nations Sustainable Development Goals, the 17 goals that they clarify to mitigate the effects of that, they're very comprehensive, and they go for no poverty and zero hunger, all the way to life on land or life on water. So it's really all about the survival of human species and the collective thriving of human species. So for us and that is really the ethos of our company, is anchored on contributing to those efforts globally. So you're asking about the specific challenge. For us, this is how we see it, is probably the most significant challenge for human survival is climate change, and the several consequences of having or not addressing that issue. They're all over the place. So that's kind of I know it's a very almost esoteric concept, but it's very real now for us.
Absolutely. Just a follow-up question, Oscar. Do you find that COVID-19 has distracted from the efforts to focus on solving climate change, or do you find that it's uniting people? Is it a device? Is it hurting or is it helping?
So I cannot really tell just yet, and the reason why is because just as I said, you have an acute pain and you try to solve it right away. But as soon as you get back to business as usual, you forget about the chronic condition that you have. And that's the one that is going to kill you. So I cannot really tell just yet. I think there's been global motivation to address this issue. And we are now realizing that we are way more capable than we really thought, working collaboratively to address this problem. Hopefully, the learnings that we are now undertaking can be extrapolated, to climate change mitigation action as well.
Okay, awesome. One last sort of, not to dwell on this topic too long, but one last sort of quirky little question. Have you seen these like news articles of like all the animals going back to the cities?
Yeah.
like the dolphins have come back into the canals in Venice,
right?
And and like the CO2 levels have dropped dramatically. They were saying how the smog in LA has never been, it's never been so clear in Los Angeles.
Right.
I don't know. Anyway, I mean, I agree with you. These things probably won't last, unfortunately, but let's cross our fingers and hope that, there's nothing like a little refresher for people to remember how good things can be in the environment or how quickly, CO2 levels can drop, where it kind of makes people start to think, oh, okay, well, maybe we can make this happen. This is possible. We can make this happen, right?
Correct. Correct. The UN is using right now the narrative of not going back to pre-COVID, but going forward to a more mature society where we take all these things into consideration.
I really hope that's the case. I'm an eternal optimist, Oscar. I argue with my past. I've got all these friends that are like preppers and doomers. They're just like, the whole world's going to end. They're like shorting the stock markets and stuff. and I find I'm like, I'm like the eternal optimist. I'm like, no, we got this. Like we're smart, we're capable. The engineers that I know are some of the most amazing engineers in the whole world.
True.
I can't imagine a world where the brightest minds can't come together and solve this thing, and not only solve this thing, but take with them ideas that can propel us into the future and make the future better.
Absolutely.
David, how about?
Hopefully we can go back to talent later, but I have a few comments on talent later.
Okay, all right, cool. No, thank you, I appreciate it. So David, how about yourself in terms of like challenges and silver linings?
Yeah, I think again, it comes back to the practice of medicine. I think we, as a community of medicine, is known for being notoriously slow when it comes to innovation and adopting new technologies. And COVID-19 has been a prime example of bringing some of those problems to light in terms of how we communicate with our patients between providers. And that's been a challenge in dealing with disease where we can't directly physically interact with our patients a lot of the time, especially in patients in isolation, as well as trying to shift towards more remote and telemedicine capabilities for our frontline healthcare providers, not just in emergency medicine, but for family doctors and our specialists that are out on the ground that have primary care roles. So that's a huge, significant challenge. However, with that comes a significant opportunity, as you mentioned. I think it gives us an opportunity to think about how we can practice medicine in the future. And I think, and I'm not saying that anytime soon doctors are going to be replaced by robots or, AI capabilities, but there is something to be said about expanding the capabilities of remote medicine and telemedicine. I'm sure you yourself or your friends have talked about how easy it is to see a doctor these days on your telephone, on a web device with new systems out there. And one of the things that's on my mind is, yes, there's a great telecommunications capability. But for me, what's lacking is devices that's able to supplement the hands of a physician, to be able to do a proper physical exam, get vital signs on a patient. And just being able to do that really provides the critical information for physicians to make decisions. And I think as we move towards expanding our solutions and capabilities in telemedicine, I'm really excited about the opportunities in innovations in medical devices and how we can supplement the physician to improve capabilities in that regard. And just to add to that, I think a remote medicine, and what I mean by that is providing medical care to communities that don't have access to physicians or nurses or healthcare providers, and that may be First Nations communities or communities that are very remote from a distance perspective. This is another amazing way for us to really improve upon those capabilities in terms of how we can make sure that everyone has access to care and safe and quick access to care in the future.
Yeah, no, absolutely. I couldn't agree more. We probably can't talk about our ideas here today, but I will mention that David, myself, and Oscar have actually collaborated recently on some concepts and ideas. I don't know how deep we can go into that, unfortunately, but it was pretty cool. I'll just sort of say a high level. It's a remote monitoring device so that patients don't have to be in the hospitals. They can be, in their beds at home. Oscar or David, do either of you guys want to talk about that at all today? I know you can't say much, but do you have any words you want to share on that, David?
Yeah, I mean, what I will say is, as I mentioned, right now, I think we have really good software and systems out there to communicate well with patients. But what's missing is data points. And the devices that we're working on provides us data points for the physicians. So it supplements our clinical decision-making on a real-time basis. And in the context of COVID, to know when patients are deteriorating, even when we're not talking to our patients in a remote, autonomous, real-time setting, to be flagged to when patients are deteriorating, which I think is super important, not just for COVID, but even beyond.
Yeah, Victoria, what do you think about all this? Are you sort of optimistic about the future with respect to some of the silver linings that COVID-19 brings?
I think COVID-19 has done a very good job of highlighting the habits in human behavior that are both positive and negative. And I think it's having to readjust when almost all of us are in a completely new setting where we can't rely on those previous habits has been really interesting. So the mental health challenges associated with not being able to communicate regularly, or even I know for some of my classmates, just not seeing each other every day has made a huge difference in how they live and rely on each other. And I think it's been hard, and there's some negative challenges, especially in the mental health aspect with such a lack of connection. But the positive is that it's bringing to light some of the things that we had previously that maybe weren't as healthy as we were thinking they were. I mean, I saw, I think it was a tweet, but it was talking about how, although we're acknowledging the mental health challenges now, we can't always go back and say that our previous work all the time habits, getting little sleep, stressful commutes, that wasn't necessarily healthy either. So I think it's in all aspects done a good job of showing you, okay, what was your previous routine? What's missing? And how does that actually compare to what you're dealing with now? And I think that cycle has been quite cool to see. And I think it'll benefit us a lot in the future.
Yeah, well said. Oscar, anything to add?
I was just going to mention a few things about talent, and how this crisis has really, what would be the right word for this? Has amalgamated some really interesting talent against a common enemy, so to speak. And so for me, at least, my personal experience has been incredible to see all these brilliant minds coming together with only one clear objective. And normally you have to go through a lot of bureaucratic hurdles that you have to clear, whether it's contracts or whatever that may be, NDAs or whatever. Right now it's like, we need to solve this, Avengers assemble, like that. And so it's just an incredible thing to see. Just wanted to add that. And Vancouver, just want to say this, and Vancouver has probably the right concentration of the proper talent and the proper, let's say, personal inclination to do good. So I'm glad to be part of this community.
So we have a couple of questions from the audience that are popping up. I'm going to start sprinkling them in here a little bit, starting with Stanley Lee's question. How dependent is it for rural communities to have the devices, fast and reliable enough internet connection for telemedicine to work? I think this is directed at Dr. David Kim. David, go ahead.
That's a great question. I think as we move forward, and I keep talking about this new post-COVID era, which may be a long time from now, but as we move forward, we have to start thinking about expanding capabilities in all types of infrastructure to allow for these kind of expansion to happen. And I think we, at this critical point, have to obviously take and use the resources that we have available to make sure that we can and use things like Bluetooth phone communications that everyone has access to in their telephone devices to make sure that we can create and overcome some of those challenges that exist. But I think, we have to think even more than that, where we have to involve increasing infrastructure capabilities for remote communities. And at the end of the day, it's not just about specific devices, it's about shifting and having a paradigm shift in medicine and beyond. To make sure that we really expand on the technologies available. Like, for example, I still carry a pager, and the number of times I send faxes to clients and referrals is dozens of times per shift. Even those little shifts like that in how we practice medicine and how we just have a big paradigm shift of how this can no longer be the status quo is, I think, what is something that we need to think about going forwards.
How do you have a pager still, David? Oh my God.
Yeah, we all carry pagers.
Is it like an actual pager, like a drug dealer pager?
It beeps and it tells you the phone number they have to page back in the hospital lines, and it is legitimately how to envision a pager to be.
And it's like a monochrome screen?
That's
Whoa.
right. It's got like pixelated writings
what?
on it.
That's great. Do you have it with you? Can you show the
You
audience?
should upload a photo of that.
I don't have it on me.
One of those
I think this is the prime example of David saying like healthcare is slow to change.
Exactly.
But
Yeah,
I also
totally.
think
Facts.
I do think though that it's important to acknowledge that healthcare changes slowly for a reason. I mean, there's elements of security that I'm really worried we're going to jump into right now during COVID-19 and be putting things online when really we shouldn't. I know even my mom's office still uses like only Ethernet cables. They do not have a wireless router for security. So aren't you worried that we're going to be jumping into using new medical devices that take advantage of this new technology without acknowledging the security risks that were and the patient privacy concerns involved?
Ready?
Anyone? David? Do you have any thoughts?
No, I mean,
Dr. David.
that's an excellent point. I think privacy should be our foremost, one of the most important things when we consider about patient data. And we have regulations in place in the States called HIPAA, similar regulations in Canada we have to adhere to, which is also important. And it's about balancing that with the need for innovation and need for change, because I'm always a proponent of change. And I think positive impetus for change, and especially interdisciplinary collaboration, which is hugely important in times of things like this, because I'm not a hardware expert, I'm not an engineering expert, I'm not a wireless communication security expert. This is where we all have to come together, not just physicians, not just engineers separately, where we need to come together and work together to find solutions to problems exactly what you mentioned. So agree, but I think there's a pathway forwards.
All right, well said. Vlad Lebrowski from ZOA has asked, do you believe that health outcomes, probably means healthy outcomes health outcomes can be improved by continuous monitoring rather than acute health problem diagnostics? Would society benefit if everyone had a remote diagnostic device at home? And I think what he means by this is like not just when they're sick, but like, almost like preventative. Yeah, who wants to tackle this one?
I can jump in a little bit. It's funny because we're so used to interacting with data mining services like Facebook and Twitter and Instagram, but we're very wary to provide information about how many steps I took today. And it blows my mind because this is a really a mind change. And you have to understand, the more information, the more anonymized information you provide, the better certain algorithms will work in our benefit. And this really is anchored on technology and science literacy. so long as people do not understand those basic concepts, we're going to have a very deep slope in climbing, in precisely what, Victoria was saying. I don't want to provide my information to anybody. It could be hacked. Yes, granted, it can. But then at the same time, we're providing free information in other outlets already that are mining our information for the benefit of their services, not our own services. So I'm a little bit on the fence on this question. I definitely believe that continuous monitoring is way better than just diagnosing something that is now expressing itself because it's been accumulated over the years. That's just me. I guess I'm a little more progressive in that sense. I know how data works, and that's probably the right way to move forward. But as I said before, and I've always said this, technology is never the problem. It's the adoption of technology. That is the main problem. And so that requires social and a mindset change.
It's an excellent point. Some people on the call might not know what MistyWest does. MistyWest is a connected devices company for health and safety. And so, obviously that means like IoT kind of stuff, and very frequent conversations that we have are about data security. A lot of IoT devices are really insecure, right? Like, it's a very common problem with IoT devices. And so I think it's a hugely important topic. The question is are there industries that could save a lot more lives if they were quicker to embrace change? And I think, I'm not here to say my opinion, but it seems likely at this stage that there are some industries that are not moving quickly enough, and COVID-19 has forced them to do so. It remains to be seen, right? Like how many bad things are going to happen as a result of as a result of this rapid change. There's going to be some bad things that happen. Like some outcomes will be bad, and you'll see, and you will read them in the headlines. We'll see them in the newspapers, like, home monitoring device doesn't work properly. Person dies as a result. We're probably going to see that, but I guess it's just hard. It's really hard to be utilitarian here, right? And think, okay, how many more people are going to benefit versus what's the that risk reward is very hard to calculate. And I think, generally speaking, certain industries are more conservative than others. All right, let's move on. We have one more question from the audience here. There was one question about privacy issues, and from Morton Koch, asking just how do we overcome the privacy issues? I think we kind of answered that already. But then he goes on to say the government is already challenged with implementing app-based virus tracking. So let's just ask a question. This is a controversial question. I'd like to know your opinion. You can pass if you feel like it's too controversial, but how do you guys feel about contact tracing apps? Centralized, decentralized, these apps that help you. Like, if you get COVID, it tells all the people, they're location based, right? So they tell all the people that got near you. Okay, Victoria, yeah, go ahead, Victoria.
I think that these are great, but I'm very weary depending on who has designed them. So generally speaking, I know that government apps and things don't tend to be as secure as they probably should be. So in that sense, I'd be very weary to adopt. But if we had something that was developed by a professional in the space, highly secure, I think it could be revolutionary. Like not exactly, but what I'm saying is I know that government websites tend to not be the top-notch security level that we would hope they would be. So as long as it's something that's highly secured, I think that it would be very beneficial in mitigating the spread.
Yeah.
So I'm pretty sure some of you already know that Google and Apple are collaborating for the framework for contact tracing, and that framework is going to be available. I believe they're going to test it this month. And so my hope is that that framework will be the basis for developing apps that get that job done.
That's got to tell you something, right, Oscar? I mean, the fact that Google and Apple are doing it.
Yeah.
And can you imagine if Facebook made an announcement saying they were going to do it? Can you imagine?
Yeah, no, it's like, nope.
People would freak out, right? I'm pretty sure. I mean, maybe I'm being a little biased here, but I don't know. David, what do you think? Is it possible? Can Apple and Google succeed at this, or are people just going to be like, no way?
I think privacy is a big concern. I actually remember watching the Snowden documentary just a few months ago, and just learning about the importance of privacy after that. I mean, I think, South Korea is a good example of how they did contact tracing. They actually used phone-based tracking software without consent to track where people have been, and notify people that they should self-quarantine. And they have been, fair enough, very effective in being able to decrease the spread of infections and quarantining people, but at the cost of privacy. So I don't think there's a right or wrong answer. It depends of our thresholds in our society's threshold for the importance of privacy versus, healthcare burden to lives, costs, and that's a big ethical dilemma that I don't have an answer to.
Well said. The last one is the last. I think this will be our last question here. Have you guys heard about Australia's solution? It's a voluntary contact tracing app that now 40% of their population is downloaded and installed.
I think that's a problem. It's going to make people too comfortable, because I was even thinking, with any system, if one person does not follow it, it gives everyone else a false sense of security. And I think that could be very dangerous. I know even in my general age group, people getting, in my opinion, too comfortable. And I think that could cause a catastrophe, because all of a sudden you've got people who are actually immunocompromised at high risk going into areas feeling comfortable, when in reality they could be putting their entire life at risk.
Right.
I also think that might be closer to home than Australia. I filled out a survey this morning, and at the end of it, it was asking if I would feel comfortable here in BC having an app like that. And I think that might be something that they're implementing sooner than you may think. But it would be a volunteer-based app for an initial trial.
Yep, a voluntary app. Well, let's end this panel on that, and we'll move on to the next panel. So really quickly, all five of you, yay or nay? If the British Columbia government released an app similar to that of Australia, voluntary, it's up to you if you want to use it or not. Would you do it? Yay, yes or no? Starting with you, Victoria. Yes or no?
I think it really depends on
No,
from.
it's yes or no. It's yes or no.
I'll say yes, generally speaking, but
comes from the government. Government.
Yay.
Okay, how about you, Elise? What do you say? You're on the spot.
Yes, but not for myself. I would do it for people around me, not so much for myself.
Got it. Laura?
I would say the same thing. I would do it, but not for myself.
David?
I would agree with that.
Yeah. Oscar?
I'll say yes.
Okay, I'm a tentative yes myself. I would analyze the code. I'd go into the open source code and be looking for the back doors. But yeah, I mean, if it was super secure, voluntary, I could deinstall it whenever I wanted. I'm a yes as well. Okay, wow, I'm surprised. I thought we'd get more no's. But okay, that's awesome. That ends the first panel. Thank you, David. Thank you, Oscar. You guys, we'd love it if you could stick around. I think you'll have the opportunity to chime in occasionally if you'd like. We'd love it if you guys could stick around. I understand you're busy though. If you absolutely have to go, no worries. And we'll move on to Elise and Laura. We'll start out with you two getting reintroduce yourself a little bit. There's some people that maybe joined us late, don't know as much about you. Starting with you, Elise, can you introduce yourself?
Well, hi again. So I'm Elise, and I work for Arbutus Medical. And my background is in biomedical engineering. Then I did a bunch of research, and now I'm an entrepreneur. And Arbutus Medical is a small local company that makes medical devices, specifically for orthopedics. So the whole concept of our product development is frugal innovation. So how can we make choices during our development process that make medical devices more affordable?
All right, thank you. Yeah, so can we get a link to Arbutus Medical posted to the chat there? One of the moderators, I appreciate that. I think the products are super cool. They look awesome, right? These covers for I mean, it's pretty gnarly tools, right? You look at them, they're saws, and they look like sawzalls that you bought, but the thing you make is the cover, right? The thing to protect the tool.
Yeah, so the principle is actually that we make an everyday hardware drill that you can buy at Home Depot, safe for orthopedic surgery. And by safe, I mean sterile.
Got it. Got it. That's
Yeah.
amazing. That's so cool.
Yeah.
That's so cool. And then so you're in it, we'll get back to this question in a second, but I want to ask you about what it's like. I know that you guys are launching new products and you're innovating during, you truly fit this panel in the sense that you are truly innovating during a pandemic in that sense. And I'd love to get to that. But first, Laura, go ahead and introduce yourself.
Again, so I'm Laura Stankiewicz. I'm currently a PhD student in biomedical engineering at UBC. But I think the reason that I'm more on this panel is that over the last 2 months, myself and a team of seven other graduate students have designed a low-cost ventilator for the COVID-19 crisis. And similar to what you and Victoria were talking about, we're also kind of dropping the C at the moment and looking where this might be fitting into just low resource settings, both in North America and low and middle income countries. Our team is called Flow02. Yeah.
I love hearing about that because that's exactly what we stand for. So the more the merrier.
I agree. We were going to reach out to Arbutus.
Yeah.
Hopefully you guys get to collaborate on something. I love that about COVID-19 is like people are I've noticed a huge surge in collaboration. I think that's wonderful. The open source, people say the open source BC, they're like, I don't get it. Like you have all these corporations and startups working with you, but they're not open source. Like why? Does that mean the OSCMSBC isn't open source? No. That's not how it works, right? The way it works is what you want is as many corporations worldwide shifting to open source, right? And that not necessarily making everything open source, right? But just that shift in that direction, I think can really make a big, and that means more collaboration, right? Academics already do this, obviously. David, you're obviously huge on that, being associated with UBC. Oscar, I know you do that as well. On that note, why don't we start with that in terms of innovation? Like, where are Elise and Laura? Where are you on the spectrum of innovation? Do you find yourselves spending more time in the sort of concepting, ideation, R&D phase, or are you spending more time in the product development, manufacturing? Where do you guys fit in that spectrum?
So I think that our team is a little bit of an anomaly in the way that we started and have almost come to a finish all within the space of the last 2 months. So we are only working on one product. And so we're following what's called the Code Life Challenge. It was put out by McGill University to create low-cost ventilators. And so we had a really intense month of product development and design iterations and testing. And since then, just kind of moving along to the stages of trying to get regulatory approval and finding manufacturers and just really figuring out a market of how you can do distribution of your product, which has all been something that's new to me as a student. And I feel like is just a small portion of what Elise is probably dealing with at the moment with multiple product lines.
Nice.
We have 3 products at the moment, but we're launching a new product in September. So we're in launch preparation mode for that product, and it will definitely be different now than if we would have done a product launch without any COVID. But in general, we have an R&D team and they're working on new products or improvements and things like that. But me, on a personal level, I am working on business development. And so I am more so working on with distributors, how to sell our products, especially now how we can't meet people anymore, or I can't go to conferences, everything is canceled. And so I am working on how to pivot our whole method of selling and working with distributors, and I'm sure our R&D team is pivoting on how to work best with manufacturers and all that.
Absolutely, yeah. So let's dive into that a little bit deeper. What is that physically like? If you're prototyping, Laura, how do you guys prototype? Do you have to wipe everything down every time you finish touching something? How do you actually physically work together?
So I've said this before, but I live on my Zoom chat pretty much all day long, whether it's with my team or with people that we're talking to outside the team. I live with one of my teammates, and so that's been useful that we can have at least 2 people together to
quarantine buddies.
Yeah, exactly. And so that has been useful. Again, we spend most of our time planning as much as possible over Skype and Zoom. And then there's only been really times where we need to have more than 2 or 3 people together, probably 2 or 3 times in the last 2 months, just when you need to bring physical components together and actually build stuff. So it's been trying to have the forethought of how to plan as much as possible before you actually need to start building, and then getting really good at using your phone to take videos of things and then sending it to teammates to try and help you troubleshoot.
Yeah, SolidWorks and Altium are your friends, huh?
Absolutely.
Yeah, no doubt. Modeling as much as you can, simulating as much as you can, I take it.
Yeah, and even just like trying to figure out what all of the issues you're going to have prior to having them, just so that you can have those conversations beforehand. It's been difficult, but it makes you really think about what you're doing, and again, planning ahead of time. I feel like as much as you can't predict the future, you can really see a lot of the issues you're going to have before they happen.
And it actually makes your process like almost better, because it's always really tempting to just like test things out right now. And even though you could, before testing, you could probably have thought about what the outcome could have been. And now you are doing that because you cannot test right now, and you need to meet with like a coworker or a teammate to actually do that. So would you say then that the process has almost improved?
It's definitely better in a few ways. And my teammates and I talk about this, where if you're having a meeting with 10 people in a room, everyone talks over each other. But if you do that on Zoom, you just cancel everyone out and nothing gets heard. So you really have to have a structure for being like, no, go ahead, speak, and I'll hold my thoughts until later. So I do think there's some pros. It's definitely faster, I think, overall to be in the same room prototyping, but that's the world that we live in, and it's just part of the innovation. I think forcing people to have to try and think differently about how they're going about designing something just like draws on some new creativity and just starts that process from the beginning. The advantages.
Yeah, absolutely. Yeah, and just to get a little bit philosophical here for a second, maybe a little bit more controversial question as well. This is a question maybe about innovation, the scientific method, scientific education, right? Scientific literacy. Did you guys, and maybe we'll open this up to everybody, but did you guys see that insane protest in front of VGH? There were like people with like signs saying that like the Illuminati invented COVID-19, and that they were blocking ambulances from getting into VGH and stuff like that. You guys, did anybody see this?
No.
It was like a lot of, yeah, it was in the news. There was like a lot of people there too. This is not just a small number of people, and they were like basically saying that COVID-19 is fake, and they're like, why is the hospital empty? Asking, as if the front entrance of the hospital is an indicator of how many people are in there with COVID-19. And I mean, what can engineers? I mean, I find myself getting greatly frustrated by this, and a lot of engineers ask me questions about it, and to be honest, I don't really have the answers. Do you guys have any advice for like young engineers, scientists, people, med school students? Like, what can we do, like when talking to our parents, when talking to our siblings, when talking to our friends, to help? I don't know what's the word, but like help. Oscar, go ahead.
We have run the Vancouver Innovation Labs for 7 years, and the reason why we created the Vancouver Innovation Labs is to include everyone. Conversations had to be cross-disciplinary. So we brought bakers, we brought politicians, we brought technologists, we brought researchers, we brought engineers, of course. But you absolutely must listen to all the voices, especially when you're trying to innovate. Somebody said in this panel, it's incredibly important that you listen to what their concerns are, and while doing so, you're educating and you're evangelizing the foundational principles of technology and science. And this is precisely why we have these issues, because we have a group of people that they have never been engaged. On the contrary, they've been dissed out by the likes of us who know technology, know innovation, know how things work. And so they live in their own bubble. And you have these expressions of ignorance. That's really what it is. I think the vaccine to that, to be more, it's to engage them. You have to engage them. You absolutely have to engage these individuals. And so, I will encourage, the people here in this panel, to do so in settings that are safe spaces for everyone to come with their opinions.
Interesting. So Oscar says engage them. Elise and Laura, a response.
Yeah, I think communication, so like a disease for me is science, or is science-based, like having a science background. I think it might help to understand certain diseases better, and what the consequences are and what we can or cannot do, versus not having that background at all, or maybe being very nervous about news. And so I think that a lot of technology and science is hard to communicate, or should be communicated in a very simple manner. I think that's also valid for a lot of companies that make like super complex products or solutions, whatever it may be. You need to be able to, in one sentence, communicate what your product does, and for that particular audience. And I think for a disease, like a worldwide disease that we have right now, I think it needs to be communicated really simply as well. And I think what we saw early on with social distancing, like the government says, practice social distancing. Well, there's five of us on the panel here, six people, including Leigh, of course, and we may have all had like a completely different understanding of what social distancing meant. And so if you say stay away 2 meters from a person that's outside of your household, I think that's a lot clearer. For me, that's a means of communicating that probably the majority of people will understand.
Absolutely. I would say the exact same thing, just the way that you're communicating things that might seem simple to people with a science or technology background, but are like a whole different language to people who are not from this field, just the majority of people. Being really careful with what words you choose to communicate all of these things with, I find really helpful explaining my research to people. And also just like, I always have to remind myself that the background that I have is not the same as everyone else who's reading these stories. And even though I might be looking at some publications about the info I'm getting from COVID-19, that's not the common source of information for most people. And so helping translate things in the news and more scientific discoveries or papers using language that is common, and just being careful with the words that you're choosing when you're doing that explanation.
Absolutely. All right, just to switch things up a little bit here, there was a question I asked the first panel. I'd like to ask the second panel the same question. This sort of challenge to silver lining, or challenge opportunity question. Yeah, can you guys name a challenge for me and how that might have turned into a silver lining or a new opportunity? Go ahead, Elise.
Yeah, like a challenge for Arbutus Medical is, well, we're doing product development now from home, and a similar way as what Laura was describing, and a challenge of selling. And so we sell a lot of our products, like either going to human hospitals or going to workshops, wet labs, where people use our products. And well, those were all canceled. They're canceled through September. But for us, it's a very effective way of people getting, well, literally hands-on experience, learning a new technique with our product. So how are we going to overcome that? And so we were forced to be very innovative in still getting that hands-on experience, or how to replace that hands-on experience. And so in a way, I'm almost working much more collaboratively with our team, which what I otherwise would have done by myself, going to distributors and work with people outside of our company. I'm still doing that, and we're getting a lot. We're having a lot more conversations with distributors and other partners that we work with that we before wouldn't have had. So the challenge is like, how do we now sell when we can't have personal contact? But the upside of it is like we're doing a lot more thinking, just what Laura was saying before. There's a lot more thinking involved, but with all aspects within our team, but also with the partners that we work with. It's actually been fantastic.
Here, Laura.
For
Same
sure.
question. Challenge and a silver lining.
Well, again, I'm a PhD student. So when COVID started, I was kind of sent home to work from home, and I can do a lot of my research from home, but at the same time, it is just not as motivating. And so a big challenge for me was trying to figure out how I could feel less helpless in this scenario. I have a chemical engineering background, and I have obviously some friends in biomedical engineering who are pretty passionate about trying to just design a product that could be helpful in this scenario. And so it was definitely just a shock with like everyone else kind of being sent home and starting to work from home. But silver lining for me is that I've spent the last 2 months working with some really like-minded, motivated people to create a product, and we've had some success and have got to learn a lot about ventilators, and also feel like we might be able to make a difference again, both now and hopefully looking into the future in some low resource settings. So I think it was like the kick to get us thinking in a new mindset and just try and broaden what biomedical engineering is meaning to me when I'm going through school.
All right, here's a question for you guys, for Elise and Laura, to ask you. I want to ask you gut feel, intuition. Do you think this is the sort of the effects of COVID-19, like the sort of the social distancing aspect, like the lingering sort of effects, as things get better? Do you think that's going to linger for years, like a year, 2, 3, 4 years? Or do you think it's going to be just a short-term thing and life is going to go back to normal? Where do you guys sit on that spectrum from like life going back to normal in the next few months to, to some of these dire predictions people are making? Where do you sit on that spectrum, Laura and Elise, starting with you two?
I would say that I'm also an optimist, but would like to be a little bit realistic that we are not going to go completely back to normal. And I hate the term new normal, but I think that a lot of the components of just social distancing when you're in public and not standing directly behind someone in line, sort of those kind of things that are being ingrained in us might stick around for longer. And that might be a good thing to just stop disease spread in general. I also think that the amount of work that's going on from home and the ability to speak with people over Zoom and have some good meetings that, again, I think they go even better sometimes because you can't speak over top of each other. I think a lot of those non-in-person meetings might continue. And that's been a lot of my social distancing experiences so far.
Makes sense. Elise?
Yeah, I'm trying to stay away from the word normal, because I think there will be lasting changes, and they might be for the better. They might take a lot for us all to get used to. And so what we're like, previously I would travel like once, twice a month. And so did some of my coworkers, or I'd be on the road for 3-4 weeks at a time. And I don't see that returning so quickly. And so yeah, I think like in-person meetings that people might be much more adverse to that. Some people might be totally fine with it. Other people will be very hesitant. So I think travel will become in a way a lot less. So the world will become in a way smaller again. But on the other hand, we're so connected using all sorts of video conferencing, and we're maybe more respectful because you can't really talk over each other as easily like using video conferencing. So yeah, there will be a new reality, I think. Yeah, not sure what that's going to look like exactly. Time will tell.
Victoria, I sort of saw you sort of perk up on this question a little bit. Did you want to weigh in real quick?
I just find it really interesting, the whole aspect of respectfulness and how that will change, especially when it comes to personal space. But things like talking over each other, I mean,
I don't know what you're talking about. I don't know what you're talking about, Victoria. I don't know what you're talking about. I'm kidding.
Ways that I don't think people will generally associate with the crisis. And I find that interesting. And I think it'll be cool to look back in 10 years' time and say, wow, this really has made an impact in ways that I wouldn't expect.
Yeah, for sure. Well said. Well said. I mean, I joke. I jokingly interrupted you, but it's funny actually. I do realize that You know, I do have a tendency to be very loud, and I talk a lot. And so one interesting thing is that the COVID-19 has done for me personally is it's helped me really ram home how important it is to shut my mouth sometimes and just listen. And so that's one silver lining for me. On that note, let's keep asking questions. We have a question from CH. How are you all collaborating open source style? What has been the most effective tool and process? I find GitHub good for software collab, but not good for non-tech people. Starting with Elise and Laura, what kind of tools are you guys using to collaborate?
Like within our team, everything is Google Drive, and so for us, like most of us are non-tech people, and who I immediately collaborate with, so everything is on the Drive, and Zoom.
Zoom, Google. What about Slack? You guys use Slack?
Oh yeah. Slack all the time.
This is from Wikipedia.
Ongoingly. Absolutely,
Right.
yeah.
Right.
And I think one more medium is well, everyone receives emails from all sorts of companies where whenever you bought something, whatever it may be, and so like video emails or emails with videos incorporated in them. That's like a lot more prevalent now for us as well.
Laura?
Yeah, I would say the same thing. Our designs are not on GitHub. At the moment, we just communicate in our Drive and continuous Slack channel messages, Skype, and Zoom. I'm reading this question, and I'm also thinking about how they might be talking about open source designs that you're making. I know that you guys, both you and Victoria, have been talking about your open source projects. Do you have an opinion on how open source projects might not be the best way to actually get your design to a customer and to someone who needs it? Just
Yes.
that's a
Victoria,
question.
go ahead.
Yeah.
Deflect.
I may deflect off to Leigh at some point here, but I think that there's a lot of risks that come with open source, especially because we're dealing with open source internationally that need to be acknowledged. I mean, something that's accepted in like San Francisco may be different than what's accepted here. And more so than that, you don't always know whose hands things are going through. And I think that can be really risky, especially when it's coming to something like medical devices. I know someone could say, this went through our medical review team in, I don't know, Boston. But how do we know that that medical review team is up to the standards of ours? And sadly, with COVID-19, we're getting a lot of blind trust. And so far, we haven't seen any big explosions, but that's, in my opinion, a when, not an if question. So there's a lot of risk. I think at the same time, there's so many benefit that it's not something that we can pass up.
That's just something our team has been grappling with, because I'm personally grappling with that you have an open source design that probably can't get regulatory approval if it's on the internet. And if you're talking about medical devices or a ventilator, in my case, that's a dangerous thing to have. But if the whole purpose is to have it open source so that people across the world can have access to it, then you're making it accessible. And that's one of our main goals. But we're trying to think as well that if you're having it online and you have all these different components that you have to buy from your hardware store or from a 3D printer, then is that really that accessible? And is it better to just try and keep the design non-open source, but then manufacture it so that it's a low-cost device and can be distributed to these low resource areas who wouldn't have access to all of those individual components? It's just a thought that I've been having with respect to all of the open source designs that are coming out of Vancouver at the moment.
Yeah, I'll say one quick thing about that. I know personally of quite a few ventilator companies. So I've been speaking with Medtronic, Thornhill, Ocalink. Of course, I talked to the Cosmic Peeps. I'm an MIT alum, so I've talked to the MIT guys, and of course the OSMS, as you guys know, Laura and Victoria already know this, of course, but just for the rest of you, there is a list of like 100 open source ventilator projects worldwide, globally, and they've been ranked. So engineers have gone through and reviewed them and ranked them. Maybe we can get a link to that from the moderators in the top chat here. Search for global open source ventilator ranking, OSMS. You should be able to find it. And so I think that and what I'm seeing though is a lot of the for-profit startup companies that are making ventilators have leveraged the hell out of those open source designs, right? that's in many cases they've started with one of those and then closed sourced it and started working on it. So I'm not the biggest fan of just like taking something, closed sourcing it. I actually like it when a startup takes an open source design, improves it, keeps some of it closed sourced, right? Put it into their own QMS, get that ISO 13485 certification, closed source some of it, but then keep some of it open source. Like if there's a big innovation challenge, I still think the open source community can really, give a big boost. But on that same note, we have a question here from Mike Taylor. How are you approaching things like patents and hardware licenses? For example, how do you feel about Creative Commons non-commercial? And do traditional business intellectual property protection models prohibit rapid innovation during times of crisis? I think we'll send this one to Elise first.
Yeah, well, we're a medical device company, and so we have to adhere to all the regulations that any medical device needs to have before you can sell it in the US or Canada, Europe, wherever really. And so yeah, we do work. We do have patents, and we're working on patents. And for us, it's a necessary thing. And but we have questions like coming up like regularly, like, oh, is open source better? Like, should we go ahead patent it? Patent is only valid in a certain geography. Should we go? What other geography should we expand it to? Like, is there a copycat waiting around the corner anyways? And I have to admit, like, we don't really have a good answer to it. But for us, it's not necessarily what we as the Arbutus team wants. It's also our board, what they want, and investors that we have, what they want. So it's not only up to us. And there is ideology versus something that's just practical or something that people are used to versus something that's completely new and rapid change, and how accepted is that?
Mm-hmm. Awesome. Laura, do you have any comments on this?
Yeah, this is something that my team is looking at and working towards at the moment. We have a design, but we're not sure. Like, again, I think that in our case, it might be more helpful for a global community if we're able to make these at a low cost and then distribute them. And so we are looking for people to license our design. And with that comes us looking what kind of IP that we have access to, or we might be able to patent. But something that our team is trying to determine is if we really want to pursue the patent, or if this is just something that we're not looking to make a profit off of, and we just want people to take and then just kind of follow through. And we're really just looking for the follow through part of that process. And so again, I don't have a good answer for you, but this is something that our team is having pretty lengthy discussions about this week.
So it's that time. It's 2:20. It means we only have 10 minutes left. Madison, normally we do a thing where we allow announcements from the hardware meetup community. It's gonna be a little bit difficult to do that this time, but I think what we should do, if Madison, if you agree, is we should allow them to post messages in the chat. So usually it's like, usually people that post are like, I have a startup company, a hardware startup company, and I would like to hire the following people. So should we still do that, Madison? Do you think that's?
Well, I am still going to do some closing slides,
okay.
Again to like list everybody's names in case anybody joined late and didn't get the names of everyone and their backgrounds. And then I was also going to leave the opportunity also, like if you guys do have any like announcements you want to share, any links, you can post them in the Zoom chat, and then I can post them into the YouTube, or you can post them directly into the YouTube live chat.
Okay, awesome. Okay, that's great. So for our panelists, if you guys want to post any links, or if you have any job postings, go ahead and post them to the Zoom chat now, and Madison will relay those along.
Okay.
You could probably just post them directly to the YouTube if you want.
Yeah, if you guys have the YouTube video open. But
yeah,
if you have wrapped it up, I'm just gonna do some closing slides and give everybody a moment here to kind of get an idea of what we just went over.
All right, well, thank you everyone. Thank you panelists. Thank you for being here today. Thank you audience, and Madison, we'll turn it over to you to conclude the hardware meetup. Thank you.
Thank you so much.
Well, I really want to thank you guys because I thought that was really informative, and I don't come from a science background or a technical background, but I still found it really fascinating what you were talking about. And I found a lot of it was in terms that I can understand. I definitely felt that when you were speaking about, you know, like empowering people that might be a bit ignorant about the science is definitely important to try and speak in non-academic terms. And because that's ultimately, that's kind of the only way that we can reach out to the largest audience. So I want to thank our partners for helping organize this event today and helping with the promotion. So thank you to Envisioning Labs and Oscar and it was the Vancouver Innovation Labs. I posted a link to their meetup in the live chat. And thank you to the open source COVID-19 Medical Supplies BC group. I will make sure that for any later events, I will drop the C from it because I noticed that it's already starting to get dropped. And to MistyWest. MistyWest is the organizer of the Vancouver hardware meetups. We are a Vancouver-based early stage product development consultancy. We work with connected devices and embedded systems. You can go to mistywest.com to see more about us. You can also send an email at contact@mistywest.com. And I want to thank all of our panelists again. So if anybody joined late and didn't get anyone's names or where they are from, please feel free to take a screenshot of the screen, and so you can get an idea if you need to reach out to anybody later. So thank you, Dr. David Kim, Oscar, Laura, Victoria, and Elise. It was really nice to have you on here. So for upcoming events, really there isn't too much on the horizon right now in our COVID-19 world, or at least in this phase 2 world in BC. But we do have something on the horizon for Vancouver hardware meetups, and that is our Robotic Overlords meetup. We had it originally scheduled for March 26th. It was canceled, or it was postponed until June 11th. Now June 11th is also looking unlikely for an event at the Microsoft office in downtown Vancouver, but we are in talks with them now of moving it to a virtual format. We're still hoping to have it in June, and we'll have an update for you in the next few weeks. It's going to be very good. Now that we're moving to a virtual format, we hope to get panelists that are not from the local area, and that maybe perhaps we can get somebody involved in the Bay Area. For announcements, I know that Laura, you called out to your Flow 02. I posted a link to it in the live chat, but if you just want to take a second to mention what you do at Flow 02 and any announcements you have, feel free.
For sure, thanks. So again, I'm one of the design engineers on the Flow 02 ventilator team. So we've created a BiPAP to ventilator augmentation kit, and we're currently looking to speak with manufacturers and licensors about carrying our design forward alongside our team. Thanks.
Thank you. And again, like another shout out for the Vancouver hardware meetups. I am the organizer for the events. If you are interested in speaking on a meetup, if you have a suggestion for a topic or interested in sponsoring an event, please let us know. Now that we are moving to a virtual format for the foreseeable future, I feel like this is actually going to open up a lot of new opportunities for us. So you can send an email to me, madison@mistywest.com. And that concludes our first webinar for Vancouver Hardware Meetup. And I want to thank our panelists again for joining us. This was I feel this was successful, and YouTube, like the stream worked, Zoom worked. It was a lot of troubleshooting to get here, and I couldn't be happier with how this turned out. And I hope Leigh is still on the call.
I am still here, yep.
Yeah, great.
All I'll say is that MistyWest is hiring. We have multiple job postings up. Please check those out. We'll drop the link in the chat. And I think we're actually posting 2 more new positions or something like that. So, so even if you don't feel like you're qualified for the roles that are posted, there are going to be more roles posted soon. So just get in touch with us. And there's actually one category called Future Westies, which is just like, you're basically just saying, I really want to work for MistyWest, and your resume goes into the system and we know who you are. That's the idea behind the whole Future Westies thing. And yeah, so stay tuned. And there's also some contractor roles coming up that aren't full-time. So for those of you who just want to contract part-time or full-time, that'd be great too. But yeah, that's all I have to say. Anything else, Madison?
I think that is it. Is there anything else that our panelists would like to share? You guys have any other announcements other than that? I think we can wrap it up.
Yeah, if you don't mind me like saying a few words. Well, first of all, thank you guys very much. I thought it was really engaging and a lot of fun to be on this panel. And so Arbutus Medical always loves hearing from people who are interested in being a part of a really awesome team. We are not hiring at the moment, but we're always looking to hear from you. Thank you.
And I will just say one little thing that Leigh might be confused about, but we at OSCMSBC are launching a fundraiser that's actually gotten a lot of matching funds. So we've got about $3,000 left in potential matching donations. So I'll put a link here. And it's just gone live today. We haven't really fully announced it to our team yet. So Vancouver Hardware Meetup gets a sneak peek, and all of it's going into nonprofit projects and donations, and everything will also get a tax receipt. So yeah.
Thank you, Victoria. Yes, I totally forgot to say that, and I'm so glad that you did. And Victoria, you actually helped create that fundraising campaign, if I'm not mistaken.
Yeah, so I'm really proud to be able to announce it, especially that we've got matching donations and tax receipts. That's pretty big. So yeah, if anyone's interested, please donate.
And I'll just add a little plug as well. Obviously, thanks everyone for being here and joining us. Our company at Difinity Solutions, we have 6 physicians on our team. So if anyone needs any clinical advice or connections, we're happy to support that. Especially if it's COVID related, we'll do some of that in kind as well. And we're also hiring a contract engineer very shortly. So keep your eye out for that and feel free to contact us. And thank you again.